Hello, everyone, and welcome to this Stormlight Bostix production. This is a newscast edition around the Bostix, a newscast edition where this is a Bostix broadcast. This is a Bostix bulletin and a newscast edition around the Communique Tsunami. This is a chartered edition and an evidence-based perspective. Here there will be an overview, if you like, in around some collaborative works. Looking at sort of integrating healthcare education for best practice, and where collaborators in around this works were between two academic institutions and two organizations or social media platforms, and two social media social media platforms primarily, and where this works looks at sort of sort of where again looks at similar works to what have been highlighted in a previous in one of the previous newscasts in this series, but looks at works from another perspective, if you like. So in around the aims of this works, so using quantitative data collection methodology, the aims and the objectives of this works was to include was to include and to sort of emboss the following. Number one, to understand which topics and subjects are most pertinent to renal patients. Number two, to understand whether retrospectively there has been a neglect on the education as part of healthcare delivery in the physical space or the physical realm, and if technology can join up the pieces. And number three, to understand which topics patients would find further support helpful, and a fourth sort of aim or objective, if you like, was to understand what education should be made available internationally, and five, to understand how healthcare and education for patients with CKD or CKD patients could be more integrated, so they feel more empowered and take more ownership in around disease. So research surrounding the need for information or educational support by CKD patients through, for example, peer or online support groups, or social media platforms is somewhat a false positive. Is somewhat a false positive. Has a somewhat false positive basis, and this particular UK investigation thus seek to provide an understanding surrounding health education or health information gaps, and proposes and sort of propagates that patients with CKD or CKD patients require educational support to better understand aspects of condition in around the condition. Um, so uh, so in around specific aspects around the background or the intro to this work, this collaborative works, there have been a push for using sort of online spaces or technology in some regard to bridge knowledge gaps in healthcare, peer support and education, and there's works again that have been that are available in the in the public domain in context of the literature, but further research still needs to explore, had required needed to explore guidance and areas of peer support and and patient education, and sort of patient education. In this context, there is also a requirement to evaluate patient and public involvement guidelines and focus on where commissioning, for example, is wanting. And a few focuses could surround, for example, e-health and e-learning modules, where patients and health professionals co-develop or co-produce initiatives. And the UK government had emphasised the importance of technology in improving health outcomes and providing smarter patient-centric care. And such initiatives would be supplementary to CAD documents that already exist, and as part of, for example, electronic patient records or EPRs. And there is now ever more need to improve healthcare integration for people with long-term conditions, and this remains perhaps one of the most pertinent challenges facing, for example, the National Health Service or NHS. Um, and with advances in point of care and improving care for people with long-term conditions, long-term conditions or LTCs, and there must involve at the same time there must must be a sort of an involved or an involved sort of shift from a reactive disease focused and fragmented model of care towards a more proactive and holistic and preventive and wherein people with long-term conditions are encouraged to play a centric role and take ownership in this context. And so by encouraging the educational basis and relating context across a range of health disciplines, this would also reduce inequity, increase literacy and language, and improve overall healthcare in around the CKD population. So now in around the CKD patients, CKD patients specifically seeking educational support. Um, it's been almost 2 decades since the UK government published a document referred to as the Expert Patient, a new approach to chronic disease management for the 21st century. The intention was that service users would lead others by example, by experts in and around disease. This document was published by the Department of Health sort of retrospectively in 2001. And although the initiative and document was published in the UK, in Australia as well, a team identified where expert patients in CKD in and around chronic kidney disease or CKD recognized areas of development relating to what was and what had been referred to as good quality information, sort of from works that was published by a team in 2018. There was an issue around the provision of appropriate culturally aware information and knowing who to contact for help in context of this particular works by this team in Australia. And this was especially important in remote communities with limited access to healthcare. And the inclusion of expert patients or service users is not sort of reported or had not been reported in the literature, at least where this works by this team in 2018 had identified. And another study, sort of more retrospectively in works by a team looking at, for example, breast cancer in Scandinavian females, highlighted significant internet use as a source of information on health and illness. And the investigation or the study indicated that language can be a barrier since default online language is in English, and the number of medical websites written in English is greater than other languages, and can be either advantageous or disadvantageous depending on who is seeking out information and context. And this work was published by a team in 2005, and there was works also that sort of followed on in followed on from by a team in 2008. So patients require a sort of rounded understanding of disease and processes. Depending on stage of severity in around chronic kidney disease, the patient must gain a comprehension of treatment modalities in line with care pathways. And this can include, for example, can include treatments such as peritoneal dialysis, home hemodialysis, in-center dialysis, and transplantations, and how treatments and therapies are delivered. For example, through where dialysis is concerned, like dialysis access through an arteriovenous fistula graft, arteriovenous fistula, a central venous catheter, or peritoneal dialysis catheter. Patients or service users also require sort of an understanding of sort of some of the some in around the medication side effects of physical aspects of disease and well-being, especially if heading towards so that the adverse interactions can be avoided. So educated, the basis around this as well is that educated patients become empowered and can make sort of more informed decisions surrounding treatment and choices. And those works again that have been sort of documented in context of the literature retrospectively from 2005 and sort of more prospectively as well. And so, in around context surrounding sort of primary care networks now, primary care networks and and allied health professionals or AHPs. Now, providing staff sort of age-centered education surrounding kidneys or renal is important owing to changes in health and disease over time. Primary care staff should also keep up to date with aspects that surround patients at risk and consult um, renal, renal guidelines to sort of help meet best practices. It is good practice to ensure sort of renal function and medicine use are regularly are sort of reviewed with GPs or general practitioners, but also with allied health professionals or AHPs, where and also with allied health professionals where applicable. In around this disease sort of monitoring sort of differ internationally, and this has been the case. This has been the case over 2 decades as well. More educational interventions are required to again are required to meet to support best practice, and this could be achieved through collaborative working through what have been referred and documented in literature as primary care networks or PCNs, and prompting AHPs or allied health professionals to be involved at primary care level. Patients may additionally require a sort of educational education and advice to support to help achieve and search out and to steer clear of misinformation as well. Now, in around this works or this collaborative works, there was a basis again again, similar to the initial newscast in this newscast edition, um, as part of this Bostix broadcast. Um, there's a sort of a methodology in around this where we looked at where the collaborators looked at patient and public involvement (PPI) and also aspects in around the ethics and material and methodologies around this as well. So a little bit around this, a little bit in around this. So topic tags were developed for this investigation, wherein topics between two social media platforms were developed, co-developed, having understood the aims and the remit of the social media platforms. And prior to the topic tags being developed, an extensive investigation for at least 1 month between March 2020 and April 2020 collated the most popular terminologies in around the social media platforms that service users had been sort of acquainted with and utilized. And this resulted in 14 different topic tags being sort of co-developed, and topics were tagged for 2 weeks per social media platform, i.e., again, where through the RPSG, the Renal Patient Support Group representing the online adult population, and 2 weeks through KDARS, the Kidney Disease and Renal Support Group, or KDARS for kids, representing the online pediatric and young people population. Topic tagging retrospectively aided the understanding of healthcare areas that are popular and where patients or service users between the two social media platforms would find advantage from sort of further educational from a further sort of educational involvement. And topic tagging have been utilized in research conducted sort of by works that have been documented and published in 2005 by an author in 2005, by an author in 2000 by an author and co-authors in 2007, and another author in 2021. And again, the in the descriptives around this, there will be resources pertaining to highlight and pertaining to the literature around this, for those who might be for listeners who would want to find out more about this works. So as part of this sort of this works as well, the collaborators sort of conducted a 16-year retrospective descriptive analysis of topics and tags between two online social media platforms, and sought to understand where there are healthcare educational inefficiencies and identify what educational needs still need to be met in the care for both pediatrics or young people and adults suffering with a chronic kidney disease. In addition, sort of quantitative data collection was implemented to understand online patient educational requirements. Again, there was a survey link to a survey link which was made available for up to 6 to 8 months through social media platforms, where participants only had to complete the survey once, and descriptive analysis was used to analyze the data. The data collection followed on from research. Retrospectively, from research published in works published by Mohammed and team in 2020. The works this research or this part of this research had sort of approached ethics identification details, where the works was put forward for where the collaborative team put the works forward. Put the works forward towards an ethics board where the work where the research was where the research had been approved, and patient and public involvement thus had been an important or PPI had thus been again an important mechanism, and involving patients or service users had added focus and rigor in around this works as well. Now, as part of this, the in around the results in around the results and the sort of descriptive analysis, if you like, in a sort of a summary, from a summary perspective. So first and foremost, as part of this, there was the 14 different sort of themes, topics that were co-developed and co-developed and the topics that were tagged in context of the themes. So there was the theme lab tests and biomarkers, biopsy and surgery, nutrition, renal replacement therapy or kidney replacement therapy, psychology and related, medication and pharmacy, lifestyle, primary care, wellness and well-being, nursing, physical activity, educational and interactive, peer support, and COVID-19 and infections. Now, in this works, the collaborators have sort of summarized the results, summarized the basis in around sort of from a descriptive analysis perspective. So quantitative data was analyzed descriptively to inform frequencies of variables and differences between variables. Quantitative analysis helped identify if there is a role, at the same time, if there is a role for allied health professionals to support patients with CKD in primary care, and to establish any correlations against any similar research. All quantitative data was analyzed using Qualtrics software, which was part of the academic, where at least where the academic institution, where one of the lead academics and researchers for this works had through the academic institution where this works was being sort of led from the at the time, there was the collaborators and the lead had a sort of approval service for Qualtrics, where Qualtrics software was available for use and approved for use. Equally, Qualtrics software helped quantify data numerically and help understand whether there are any sort of particular or any statistical significances. Qualtrics software was the only sort of survey software validated validated and authorized by the academic institution where this research was being led from at the time. So in around the CKD patients, the following questions were had made part of the part of surveys, the surveys that have been implemented. So number one, describe your CKD status. Number two, perception of CKD in primary care. Three, whether they received extended education. Number four, future models of care. Five, CKD and primary care education. Five, technology and digital healthcare. Six, information, communication and technology. Number seven, appropriate support surrounding healthcare access. Uh, number yeah number number six, information and communication technology. Number seven, appropriate support surrounding healthcare access. Number eight, healthcare communication and support. Number nine, influences on taking ownership. Number 10, ongoing learning and care. 11 in around gender. Number 12, age. And number 13, in around ethnicity. Now, in around this, the data can be is the data collected is as thus. So patients with CKD that contributed the highest included transplant recipients, where just over 60% highlighted their status in around CKD. Second were end-stage renal disease patients or recipients, and those specifically on hemodialysis as a form of renal replacement therapy were just over 13%, and patients with CKD stages 3 to 5 help also completed this survey, where it was just over 10%, and the lowest responses included CKD suspect and high risk, where there was no respondents, and there was no respondents in around this, and in around a lot of data in around this was that total of a total of patients with CKD who contributed relating the appropriate support surrounding healthcare. The highest response included in around the question, for example, in this survey, that I have the ability to communicate with a health professional about blood tests and investigations, where those who completed this particular survey or part of this survey and part of this question was where those completed just over 25%. The second highest response included healthcare professionals, including the question regarding healthcare professionals should be prompted for more patient activities, and where respondents completed this question was just over 23%, and also where there was a question, and I have a question that I have links to patients with CKD for peer support are needed, so I can share experiences, and where the respondents around this was just over 25% as well. The lowest response included in around a question, I have the ability to access supplementary education from health professionals who conduct laboratory investigations, which was just over just under 6%, and the data. So this the collaborative works in around this has data in around in around those who polled in, who completed the survey, where data included data included and was in and around the gender, age, and ethnicity as well. The In around the health professionals, there was similar sort of similar themes in around the data collected. So, for example, number one, describe your profession. Number two, perception in primary care. Three, extended education provision. Number four, future models of care. Number five, CKD and primary care education. Number six, healthcare professions and electronic patient records, or EPRs. Number seven, primary care and electronic healthcare records, EPRs. And number eight, information, communication, and technology. Number nine, technology and digital healthcare. Number 10, allied health professionals and future roles. Number 11, skill mix and leadership. Number 12, safety and governance in primary care. And 13, screening and biomarkers. And 14, in around questions sort of 14 to 16, it was in around gender, age, and ethnicities, which were in regard to questions 14, 15, and 16. So in around this, two of the highest response relating to regarding information communication technology included one of the it was in around one of the questions one of the responses was around one of the principal roles of healthcare professionals is using information communication technology, or ICT, wherein respondents were respondents who responded to this particular question in the survey was just over 16, was just under 17%. And technical issues is a barrier to ICT or information communication technology, which is just under 17%. Second highest response relating to ICT was where healthcare professionals are unwilling to use or contribute through information communication technology, where the response was just over in around 11%. And two of the highest responses related to allied health professionals and future roles will increasingly work with general practitioners to provide laboratory screening and point of care testing, or POCT, advice and or education. The response was just under 17%. And healthcare scientists and allied health professionals, or AHPs, to deliver more NHS professional services such as educational support, understanding of disease trends, and in around medicines, and where the response was just under 15%. Two of the second highest responses included allied health professionals would provide more sort of supplementary education and health promotion services, where the response was just under 10%, and allied health professionals and in around allied health professionals will support GP practices or GP surgeries more efficiently, streamlining practice, was just where the response was just under 10%. Three of the lowest responses included patients will have access to allied health professionals through educational podcasts or webinars. This response was just under 2%, just over just under 2.5%. And patients will have access to allied health professionals through a smartphone, for example, through a smartphone for supplementary education and support. And the response was again just under 2.5%. And those and finally and another and in around patients will have access to allied health professionals through social media or instant messaging apps for supplementary education and support. The response in around this was again just under 2.5%. And the data in around this works highlights also similar to the patient cohort in around where data summarizes between around the gender, age, and ethnicity of respondents as well. So in around the sort of conclusions, the conclusions of this of this works. So near 2 decades, patients have been sharing experiences and understanding between two online social media platforms to help inform smarter care and decision making. Using online support groups such platforms as Space, wherein they otherwise have service users otherwise have limited peer support and communication. One could debate that what context that what in around this as well, similar to some of the findings to one of the previous newscasts in this series, was that one could debate in around what is shared through social media platforms, what is shared in the context that is shared across social media platforms, is that the understanding may be construed differently, and whether it is deemed as clinically relevant as in works that has been published by works that has been published and highlighted by Van Dam and team in 2017. And so patients in around this as well, patients are not patients generally, or service users generally, are unfortunately not trained to communicate a clinically relevant context. And it could also be debated that most of the shared experience through social media platforms is generally all important and actually all relevant as well. Patients have their service users of patients have their own ways of sharing, understanding, interpreting, and communicating health complexities. And there's works by Mohammed and team in 2020 that have highlighted this, in around this. This particular collaborative works was a snapshot investigation that highlights the need for for healthcare professional involvement to support service users seeking out education in addition to peer support. Education could be equally delivered through online podcasts and webinars, for example, and through online podcasts and webinars, and as the NHS. In context of the NHS or National Health Service, needs sort of commissioning, it needs commissioning and requires sort of investment in this aspect of healthcare delivery. This is the first this works or investigation was the first sort of international sort of retrospective investigation that examines examines educational gaps between online pediatric and young people and adult renal cohorts close to or near to 2 decades. And so co-developing educational modules involving patients and health professionals, service users and service providers would prompt a sort of more joined up care in meeting educational needs and addressing healthcare inefficiencies. Again, there will be a sort of some descriptives, some sorry, in the descriptives on social media alongside this sort of newscast. There will be some resources for listeners to check out as well. So that draws this newscast and around this Bostix broadcast to a close. This has been a Bostix broadcast part of the newscast edition, a Bostix bulletin, and part of the Communique Tsunami, and a chartered edition, and another evidence-based perspective. Thank you.